So for this last functional activity, we are going to do sit to stand with one leg. You will start standing, and then you'll shift your weight, sit down, stand back up. Let's just do a regular sit to stand to start. Remember, you want your ankles under your knees. Separate your feet just a little bit. There you go. Hands on your knees. And then you're going to rock forward, nose over toes, stand straight up. Good job. When you sit back down, same thing, nose over toes, sit back down, hands on thighs. Good job. So we're going to do that same thing, but it's on one leg this time. All right, stand up. Oh, I should have instructed you a little bit better. I just meant stand up with two legs. You don't have to do it again. You can stay standing. All right. You're going to shift your weight now. Stand on your right leg. How does that feel?
Good.
Are you
okay?
Close enough to the chair?
Yes.
Okay. So hands are going to be on your legs again. Try to sit back. Good job. Same thing. Try to stand up. Oh, but remember, we're one-legged. Standing on the right leg. Switch. There you go. Same leg. Good job. Now I want you to do it same leg, same foot, 10 more times. Good job. And when you start to get tired, you can always use this couch to stand. Good job. And like I said, we would do 3 out of 10 for a full set to work on hip flexion and knee flexion for gait pattern. Also helping with the Trendelenburg gait after doing hip abduction. All right, Mr. Garcia, I'm going to help you back up. Actually, let's see you do it on your own. Very nice. I'm just going to stand by you as you walk back to the bed. Go ahead and have a seat. We'll get this gait belt off of you. Okay, so we are going to go over some home exercises. The first one we're going to do is going to address your head. So your chart shows that your head is a little bit forward. Do you find that in the discomfort that comes with it, some headaches? Got it.
Yes.
So what we're going to do is try and strengthen those muscles that hold it back in place. So take your finger onto your chin and just start to push your chin back. And then let it release. And push it back again. Let it release. And push it back. Release. And back. Now I'm going to stop doing it, but I want to see you. Release. And back. Release. Now try to do it more with your hands and not, or try to pull your chin in and not so much back. There. That's it. Nice. It doesn't have to be as intense. There you go. So I want you to do that 3 times a day. Or I want you to do 3 sets of that, 12 times each set. You can do it as many times a day as you want. But if it starts to hurt, stop. The next thing that we're going to do is what else are we doing? Oh, we're going to do anterior pelvic tilts. So I'm going to have you lay down to do this, actually. So head here, knees bent again, feet planted. And this time you're going to take your hands in a triangle, and you're going to put it right on your pelvis. Your thumb should be right below your belly button, and your fingers should be right above your pubic bone. Nice. It's going to be like you have a marble inside of your triangle. And you're going to tip your marble down towards your fingers. Let me see that. Yeah, good job. Now tip the marble back up towards your thumbs. Really nice. Let me see that again, down towards your fingers. All right, hold this position for a moment. Do you feel that tilt in your pelvis? This is called an anterior pelvic tilt. Really, it just means that your pelvis is tilting up. Opposite direction, when the marble comes towards your thumbs, that's posterior pelvic tilt. This is something that your body seems to be pretty familiar with, yes?
Yes.
This is what's kind of causing the slouching and making it hard to sit, right?
Yes.
So what we're going to do at home is just anterior pelvic tilts.
Okay.
And you'll come back to neutral. So marble to your fingers, marble back to center. Marble to fingers, marble to center. And I want you to do 50 of those 2 times. So you could do 50 in the morning, 50 at night. You could do 100 in one sitting. But I want your low back to start getting that motion again. So that when you're sitting, when you're standing, hopefully when you go back to work soon, that action of lifting is going to become a little bit easier and not have so much weight.
Okay.
Okay, great. Go ahead and roll onto your side again. Keep your knees bent. Press up to a seat. So this piece of paper has your home exercise programs on them. So as you see, there's the pictures of them doing it. And then there's an explanation here too. And if you have any questions, feel free to call us. The last thing I wanted to go over though was the diabetes mellitus and what can happen with ulcers. So I've also included some of that information right here. What you want to do is ensure that your feet are dry. So in a wet, warm environment, there's going to be a higher likelihood of just breakdown of the skin. You know that raisin-like material that our skin will do when it gets really hydrated. So you want to keep your feet dry. You want to inspect your shoes to make sure you don't have any, rocks or twigs or anything like that that could puncture the skin, creating these ulcers. One of the more important things to keep in mind, it says right here, with pressure, it's going to change the timing of your healing. So in order to avoid all of those things, inspecting your feet daily is going to be very important. So when you wake up in the morning, maybe in the afternoon, and especially when you're going to bed at night, even maybe an exfoliation of the feet or cleaning of the feet as you inspect them in the evening will be really good preventative measures, just so that we can avoid any ulcers, because I see you haven't had any, so let's keep that positive track record up.
Great.
Awesome. Well, son, thank you so much for helping to translate. And Mr. Garcia, it was really nice to meet you. I look forward to seeing you again. Do you have any questions for me?
No, I don't think. No.
Okay. Well, when you do, call the clinic. I'm happy to speak with you, or one of our other therapists can. And I will see you next Friday. Does Friday work in your schedule?
Yes.
Okay. So your therapist wants you to go 3 times a week for 6 weeks. The doctor prescribed that. So I'm going to get you booked out for the next 3 weeks. And then you will get everything, or the front desk will get you settled with the booking for the next 3 weeks. And then I will hopefully see you back here Friday.
Okay.
Great. It was nice to meet you, Mr. Garcia.
Thank you.
Thanks.